the NHIF is a critical cog in the attainment of universal health coverage here in Kenya. Are you convinced that NHIF, as currently constituted, is well primed to deliver on that mandate?
Well, I mean, there are areas, the concept is great. The context is not taken care of. What do I mean by context? What is the health informatics in Kenya? For example, if you look at the patient to doctor ratio, in Kenya, for one doctor, you have 10,000 patients. The global requirement is one patient, one doctor for 1,000 population. Bed. In Kenya, for one bed,
sorry, you said one patient for one doctor to...
Yes, one doctor to 10,000 patients in Kenya. The world recognized average needs us to have one doctor for 1,000 patients. In Kenya, we're doing 10,000.
No.
Sorry?
1,000. It's 1,000. I mean, it is 6,500. 6,500. That's according to the Ministry of Health.
Well, even if you take 6,500,
well, we are still way off.
The requirement is one doctor per
1,000
for 1,000 population, and this
so
means
one doctor is serving six times more patients.
But even that is not the issue. The other big issue is that we have one bed for 1,000 people in Kenya. And then only 58% of beds in Kenya have oxygen, which means if there's critical illness, that's a challenge. But also look at these numbers. The issue is, even when I talk about context, the distance to a hospital. For example, in Kisii is 2.4 kilometers. Bondo is 3.4, just mentioned some. Kwale, 4.7. Makueni, 4.5. And the worst time is the distance, because the roads are bad. So there are places where you take 130 minutes to the nearest hospital. So if you look at that,
would be this?
I mean Kenya mostly, because they talk about the issue average between 130 minutes to the lowest being 128 minutes on average to reach the nearest health facility. That means that in critical illness, that's why you also the numbers about women. Maternal health for women is a serious issue, because women die just before giving birth, and childbirth has become dangerous because of that time, the issue of bed, and the other thing is getting a physician. So I can tell you have NHIF card, but how long does it take to get to hospital? How easy is it to access a bed? How easy is it to access a doctor? So I'm trying to say the universal health coverage is not about health financing only, which is offered by NHIF. It is about ensuring that people can access universal. Remember, the word universal here means more. You see, doctors are talking about the issue that they need people to be employed, nurses, doctors. They need to have good packages. They need to have what's called training, capacity building. So there's a more to achieving universal health coverage than just giving you NHIF card, because if you are in Bondo and you cannot be able to see a doctor within